Hi everyone. Today we'll be learning about the development of tooth. Before we go into the core topic, let's see where the whole story started. It starts with the primitive oral cavity, also known as stomodium, which is lined by stratified squamous epithelium called as oral ectoderm or primitive oral epithelium. The oral ectoderm contacts the endoderm of the foregut to form a membrane which is called as buccopharyngeal membrane. So what is the buccopharyngeal membrane? It is the oral ectoderm with the endoderm of foregut. It's a membrane formed by the oral ectoderm contacting the endoderm of the foregut. Now at about 27th day of gestation, this membrane will rupture and the primitive oral cavity will establish a connection with the foregut. Now, most of the connective tissue cells underlying the oral ectoderm are of neural crest or ectomesenchyme in origin. These cells are thought to instruct or induce the overlying ectoderm to start tooth development, which actually begins in the anterior portion of what will be the future maxilla and mandible and proceeds posteriorly. Now, so far I have been using the terms ectoderm, endoderm, and mesoderm. What are they? These are the three primary germ layers. And the neural crest cells or the ectomesenchyme, which is considered as a fourth primary germ layer, also arises from the ectoderm or mesoderm. Coming to the dental lamina. Now, as I said, at the 27th day of gestation, the buccopharyngeal membrane will rupture. 2 or 3 weeks after the rupture of the buccopharyngeal membrane, when the embryo is in about 6 weeks old, certain areas of the basal cells of the oral ectoderm will start proliferating rapidly. This leads to the formation of a primary epithelial band, which is a band of the epithelium that has invaded the underlying ectomesenchyme along each of the horseshoe-shaped future dental arches, that is your maxilla and mandible. As you can see in this picture, these are the horseshoe-shaped arches which are which is lined by the primary epithelial band. At about 7th week, the primary epithelial band will divide into an inner process, that is the lingual process, called as dental lamina, and the outer process, that is a buccal process, called as vestibular lamina. Now the dental lamina serves the primordium for the ectodermal portion of the deciduous teeth. So where do we get our deciduous teeth from? We get it from the dental lamina. And later, during the development of the jaws, the permanent molars will arise directly from the distal extension of this dental lamina. So we get our deciduous teeth from the dental lamina, whereas the vestibular mucosa is formed by the vestibular lamina. Now, as we get the deciduous teeth from the dental lamina, the distal extensions of the dental lamina will give rise to our permanent molars. Now, the development of first permanent molar is initiated at the 4th month in utero, whereas the second molar is initiated about first year after birth and the third molar at the 4th or 5th years after birth. The distal proliferation of the dental lamina is responsible for the location of the germs of the permanent molars, as I said before, in the ramus of the mandible in case of mandible and tuberosity of maxilla in case of maxilla. The successors of the deciduous teeth, that is the permanent anteriors and premolars, develop from a lingual extension of a free end of the dental lamina, which is present opposite to the enamel organ of each deciduous tooth. The lingual extension of the dental lamina is named the successional lamina and develops from the 5th month utero to the 10th month of age. Now, as you can see in this picture, it depicts the stages of the tooth development. It starts with the oral epithelium and enamel organ at bud stage and continues from bud stage to cap stage and then goes to bell stage, advanced bell stage, and it starts emerging into the oral cavity, and these are the later stages of after the emergence. Now, it includes growth, calcification, eruption, and attrition in its fate of life, where the bud stage includes the initiation of the growth, cap stage includes the proliferation of the cells, and bell stage includes morphodifferentiation and histodifferentiation. Morphodifferentiation is nothing but knowing the morphology, the size, shape, and size and shape, whereas histodifferentiation is the histology, that will be knowing about the cells of the epithelium and the connective tissue. Moving on to the fate of the dental lamina. It is evident that the total activity of the dental lamina extends over a period of at least 5 years. Any particular portion of the dental lamina functions for a much briefer period, since only a relatively short time elapses after the initiation of the tooth development before the dental lamina begins to degenerate at that particular location. But dental lamina may still be active in the third molar region after it has disappeared elsewhere, except for the occasional epithelial remnants. As the teeth continues to develop, they lose their connection with the dental lamina. They later break up by a mesenchymal invasion, which is at the first incomplete and does not perforate the total thickness of the lamina. We also see the remnants of the dental lamina, and the remnants of the dental lamina which persist as epithelial pearls or islands within the jaws are called as the cell rest of serous. They may be seen in jaws as well as in gingiva as epithelial pearls or islands. Now the vestibular lamina. So what is the vestibular lamina? Vestibular lamina is the buccal process of the primary epithelial band. As I said in the starting, the primary epithelial band is divided into a buccal process and a lingual process, an outer process and an inner process. The buccal or the outer process is called as the vestibular lamina, and the inner or the lingual process is called as your dental lamina. Now coming to this vestibular lamina, which is the buccal process of the primary epithelial band. The buccal and the labial to the dental lamina in each dental arch, another epithelial thickening develops independently and also in later stages. It is the vestibular lamina, also termed as the lip furrow band. It subsequently hollows and forms an oral vestibule between the alveolar portion of the jaws and the lips and the cheeks. So, the hollow place which we see between your cheeks and the lips and your alveolar arch is your vestibular lamina, is the vestibular lamina, which is what forms a future oral vestibule. Now let's brief out what we have learned enough. The development of dental lamina. So as I said, a buccopharyngeal membrane is formed. So what is a buccopharyngeal membrane here? It is a connection formed by the ectoderm of the oral epithelium and the endoderm of the foregut. Now once this buccopharyngeal membrane ruptures at the 27th day of gestation period, it will establish a connection between the oral cavity and the foregut. Now we see proliferation of this oral ectoderm at the 6th week, forming a primary epithelial band which is divided into two processes, outer process and an inner process. The outer process is your vestibular lamina or the lip furrow band which forms the oral vestibule, and your inner process is the dental lamina which forms the deciduous teeth. It has a distal proliferation which contains germs of the permanent molars. It has a lingual extension, that is the successional lamina, which has the germs of all the other permanent teeth, and it degenerates later to form, and remnants might be left out, which are called the remnants, which are the remnants of cell rest of serous, which appear as epithelial pearls or islands in the gingiva or jaws. Now coming to the core topic, tooth development. At certain points along the dental lamina, each representing the location of one of the 10 mandibular and maxillary deciduous teeth, the ectodermal cells multiply still more rapidly and form little knobs that grow into the underlying mesenchyme. Each of these little downgrowths from the dental lamina represents the beginning of the enamel organ of the tooth bud of a deciduous tooth. Not all of these enamel organs start to develop at the same time, and the first to appear are those of the anterior mandibular region. So the first to appear are the anterior mandibular region. As we all know, the first teeth to erupt are also your mandibular incisors, central incisors. Now as the cell proliferation continues, each enamel organ increases in size, sinks deeper into the ectomesenchyme, and due to differential growth changes its shape. As it develops, it takes on a shape that resembles a cap with an outer convex surface facing the oral cavity and an inner concavity. On the inside of the cap, that is inside of the depression of the enamel organ, you see ectomesenchymal cells increase in number. Now the tissue appears more dense than the surrounding mesenchyme and represents the beginning of the dental papilla. So what is the dental papilla? Dental papilla is nothing but the ectomesenchymal cells which are seen on the depression, that is the inner side of your enamel organ. Surrounding the combined enamel organ and the dental lamina, we see the third part of the tooth bud, that is your dental sac or dental follicle. So here we have come across three names. Your enamel organ. Enamel organ will have an invagination on the inner side, where you see the ectomesenchymal cells proliferating forming your dental papilla. The enamel organ and the dental papilla together are covered by another another structure called as your dental sac or your dental follicle, and consists of ectomesenchymal cells. It also consists of ectomesenchymal cells and fibers that surrounds the dental papilla and the enamel organ. Now, thus, the tooth germ consists of the ectodermal component, that is your enamel organ, and ectomesenchymal component, that is the dental papilla and dental follicle. So, enamel organ is of ectodermal in origin. Don't confuse yourself. It is ectodermal in origin, whereas your dental papilla and dental follicle is ectomesenchymal in origin. Now, the tooth and its supporting structures are formed from this tooth germ. That is, these are the tooth and the supporting structures are formed from these three structures of the tooth germ. The enamel is formed from the enamel organ, the dentinal pulp is formed from the dental papilla, and the supporting tissues, that is your cementum, periodontal ligament and alveolar bone, are formed from the dental follicle. Now remember this way, enamel organ, as it has enamel in its name, so enamel develops from the enamel organ. Dental papilla, D and P. So it has D and P in its name. Dentine and pulp, which also have D and P in their names, develop from the dental papilla. Coming to dental follicle, what are left in tooth and tooth supporting structures? Your cementum, alveolar bone and PDL is the only remaining thing. So they develop from the dental follicle. Coming to the developmental stages. Although tooth development is a continuous process, the developmental history of a tooth is divided into several morphologic stages for a better descriptive purposes. While the size and the shape of the individual teeth are different, they pass through similar stages of development. They are now named after the shape of the enamel organ. Like whatever shape the enamel organ takes, it represents the name of the stage. Like that is the bud stage, cap stage and bell stage. The epithelium of the dental lamina is separated from the underlying ectomesenchyme by a basement membrane. Simultaneous with the differentiation of each dental lamina, round or ovoid swellings arise from the basement membrane at 10 different points, which is nothing but your 10 deciduous teeth, future deciduous teeth. Now, these are the primordia of the enamel organs, the tooth buds. Thus, the development of tooth germs is initiated and the cells continue to proliferate faster and faster than the adjacent cells. The dental lamina is shallow and microscopic sections often show tooth buds close to the oral epithelium. Since the main function of certain epithelial cells of the tooth bud is to form the enamel, these cells constitute the enamel organ, which is critical to the normal tooth development. In bud stage, the enamel organ consists of peripherally located low columnar cells and centrally located polygonal cells. Remember, you see only two types of cells in bud stage. One is your peripherally located low columnar cells and centrally located polygonal cells. Many of the cells of the tooth bud and the surrounding mesenchyme undergo mitosis. As a result, an increased mitotic activity and the migration of the neural crest cells into the area, the ectomesenchymal cells surrounding the tooth bud condense. The area of ectomesenchymal condensation immediately subjacent to the oral organ is the dental papilla. As I said, once the oral organ will start invaginating, accommodating the ectomesenchymal cells, that place is your dental papilla, which forms a future dentine and pulp. The condensed ectomesenchyme that surrounds the tooth bud and the dental papilla is a dental sac, that is your dental follicle, which forms the future supporting structures. Both the dental papilla and the dental sacs become more well defined as the enamel organ grows into cap and bell shapes. Cap stage. As the tooth bud continues to proliferate, it does not extend uniformly into a larger sphere. As I said, it does not grow uniformly. Instead, you see an unequal growth in different parts of the tooth bud, which leads to your cap stage. That is what gives the enamel organ a cap shape, which is characterized by a shallow invagination on the deep surface of the tooth bud. So this invagination is nothing but your ectomesenchymal cells proliferating to form your dental papilla. In this stage, you will see the outer and inner enamel epithelium. The peripheral cells of the cap stage are cuboidal, cover the convexity of the cap and are called the outer enamel epithelium. So the outer enamel epithelium consists of cuboidal cells, and the cells in the concavity, that is on the inner side, which will line your ectomesenchymal cells, that is your future dental papilla, is your inner enamel epithelium, which consists of tall columnar cells. So you see cuboidal cells on the outer side forming the outer enamel epithelium, and you see tall columnar cells on the inner side forming the inner enamel epithelium. The outer enamel epithelium is separated from the dental sac and the inner enamel epithelium from the dental papilla by a delicate basement membrane. Hemidesmosomes anchor the cells to the basal lamina. The enamel organ may be seen to have a double attachment of the dental lamina to the overlying oral epithelium, enclosing the ectomesenchyme between these attachments. This enclosed ectomesenchyme is called as enamel niche. This appearance is due to a funnel-shaped depression of the dental lamina. So, enamel niche is a ectomesenchyme in origin. In cap stage, along with the outer and the inner enamel epithelium, we also see another layer called as a stellate reticulum. The polygonal cells which we see in the bud stage, that is the central polygonal cells which are located in the center of the epithelial enamel organ between the outer and inner enamel epithelium, will begin to separate due to water being drawn into this enamel organ from the surrounding dental papilla as a result of osmotic force exerted by glycosaminoglycans contained in the ground substance. So these glycosaminoglycans exert an osmotic force due to which the water is induced into the enamel organ, causing spacing between the cells in the central polygonal cells. Now, as a result, the polygonal cells will become star-shaped but maintain the contact with each other by their cytoplasmic process. As these star-shaped cells form a cellular network, they are called as stellate reticulum. This gives the stellate reticulum a cushion-like consistency and acts as a shock absorber that may support and protect the delicate enamel-forming cells, that is your amyloblasts. Now let's talk about 4 important temporary structures which we see in cap stage. The cells in the center of the enamel organ are densely packed and form the enamel knot. This knot projects in part towards the underlying dental papilla so that the center of the epithelial invagination shows a slightly knob-like enlargement that is bordered by the labial and the lingual enamel grooves. At the same time, a vertical extension will be seen from this enamel knot and it's called as enamel cord. It's a cord-like, so it's an extension from the enamel knot. When the enamel cord extends to meet the outer enamel epithelium, this is called as enamel septum. Septum is nothing but a separation. So it is called a septum because it would divide the stellate reticulum into 2 parts, because it travels from the inner enamel epithelium towards the outer enamel epithelium through stellate reticulum. It has to pass through the stellate reticulum. So it divides the stellate reticulum into 2 parts, forming a septa. Hence it is called as enamel septum. Now, the outer enamel epithelium at the point of meeting shows a small depression which resembles a navel, that is your umbilicus. Hence, it is called as enamel navel as it represents the umbilicus. Now, these structures, your enamel knot, your enamel cord, your enamel septum and enamel navel are the temporary structures, and are also known as transitory structures as they disappear before the enamel formation begins. The enamel knot and cord may act as a reservoir of dividing cells for the growing enamel organ. Now coming to the dental papilla in cap stage. Under the organizing influence of the proliferating epithelium of the enamel organ, the ectomesenchyme, that is the neural crest cells that is partially enclosed by the invaginated portion of the inner enamel epithelium, will start proliferating. It condenses to form dental papilla, which is a formative organ of what? The dentine and the pulp. Now the changes in the dental papilla occur hand in hand with the development of the epithelial enamel organ. Although the epithelium exerts a dominating influence over the adjacent connective tissue, the condensation of the dental papilla is not a passive crowding due to the proliferating epithelium. The dental papilla shows the active budding of capillaries and mitotic figures, and its peripheral cells adjacent to the inner enamel epithelium enlarge and later differentiate into what is the odontoblast, that is the dentine forming cells. There is a marginal condensation in the ectomesenchyme surrounding the enamel organ and dental papilla to form what is known as the dental sac or the dental follicle. Gradually in this zone, a denser and more fibrous layer develops, which is a primitive dental sac. As the invagination of the epithelium deepens and its margins continue to grow, the enamel organ assumes a bell shape. 4 different types of epithelial cells can be distinguished on light microscopic examination of the bell shape of the enamel organ. That is, the cells form the inner enamel epithelium, the stratum intermedium, the stellate reticulum, the outer enamel epithelium. Now here we see a new member, that is the stratum intermedium. The junction between the inner enamel epithelium and the outer enamel epithelium is called as the cervical loop, and it is an area of intense mitotic activity. Inner enamel epithelium in the Bell stage consists of a single layer of cells that differentiate prior to the amelogenesis, that is a process of formation of enamel, into tall columnar cells called as ameloblast. What are these ameloblasts again? These are the enamel forming cells. These cells are 4 to 5 micrometers in diameter and about 40 micrometers in height. These elongated cells are attached to one another by junctional complexes that laterally enter the cells in the stratum intermedium by desmosomes. Cells of the inner enamel epithelium exert an organizing influence on the underlying mesenchymal cells in the dental papilla, which later differentiate into odontoblasts. These are the dentine forming cells. A few layers of squamous cells forms the stratum intermedium between the inner enamel epithelium and the stellate reticulum. So the stratum intermedium is a new member which we see in Bell stage and is seen in between the inner enamel epithelium and the stellate reticulum. These cells are closely attached by desmosomes and gap junctions. Desmosomal junctions are also observed between the cells of the stratum intermedium, stellate reticulum and inner enamel epithelium. The well-developed cytoplasmic organelles, acid mucopolysaccharides and glycogen deposits indicate a high degree of metabolic activity. Also, the cells of this layer are associated with high activity of alkaline phosphatase. So, where we see a high alkaline phosphatase activity in stratum intermedium and Bell stage. The cells of stratum intermedium work synergistically with the cells of the inner enamel epithelium as a single functional unit and forms the enamel. It is absent in the part of the tooth germ that outlines the root portion, obviously, because the root portion is covered by cementum instead of enamel. So, we usually do not see stratum intermedium in the part of the tooth germ that outlines the root. Stellate reticulum expands further mainly by an increase in the amount of intercellular fluid. The cells are star-shaped with a long processes that anastomose with those of the adjacent cells. Desmosomal junctions are observed between the cells of the stellate reticulum, stratum intermedium and outer enamel epithelium. So, we see desmosomal junctions where in stellate reticulum, stratum intermedium and outer enamel epithelium. Before the enamel formation begins, the stellate reticulum collapses, reducing the distance between the centrally situated ameloblast and the nutrient capillaries near the outer enamel epithelium. Its cells then are hardly distinguishable from those of the stratum intermedium. This change begins at the height of the cusp or the incisal edge and progresses cervically. The cells of the outer enamel epithelium flatten to a low cuboidal form. At the end of the Bell stage, preparatory to and during the formation of enamel, the formerly smooth surface of this outer enamel epithelium will form folds. So, ideally the outer enamel epithelium surface is smooth. But later at the end of the Bell stage, that is as the Bell stage advances, you start seeing folds. Between these folds, the adjacent mesenchyme of the dental sac forms a papilla that contain capillary loops and thus provide a rich nutritional supply for the intense metabolic activity of the avesicular enamel organ. So, in the advanced Bell stage, from where does the enamel organ gets the nutrient from? It gets the nutrient from the dental sac, by which forms capillary loops into folds formed on the surface of the outer enamel epithelium. This would adequately compensate the loss of the nutritional supply from the dental papilla owing to the formation of mineralized dentine. This change in the nutritional supply is called as reversal of nutritional source, which we see in advanced Bell stage. That is, from the dental papilla, the nutritional supply goes into the hands of dental sac. The dental lamina is seen to extend lingually and is termed as successional dental lamina. So, if it extends distally, it gives rise to your permanent molars. The extension of lingually is called as your successional dental lamina, as it gives rise to your permanent successes of deciduous teeth, that is your permanent incisors, canines and premolars in the place of your deciduous molars. The enamel organ of the deciduous teeth in the Bell stage show successional lamina and the permanent successive teeth in the bud stage. The dental papilla in Bell stage is enclosed in the invaginated portion of the enamel organ. Before the inner enamel epithelium begins to produce enamel, the peripheral cells of the mesenchymal dental papilla differentiate into odontoplasts, that is the dentine forming cells, under the organizing influence of the epithelium. Firstly, they assume a cuboidal form. Later, they assume a columnar form and acquire the specific potential to produce dentine. So, the dentine forming cells, that is odontoblast, are in columnar shape. The dental papilla ultimately gives rise to dental pulp once the dentine formation begins at the cuspal tip. The basement membrane that separates the enamel organ and the dental papilla just prior to dentine formation is called as the membrana preformativa. So, membrana preformativa is nothing but the basement membrane which is present between the enamel organ and the dental papilla just prior to the dentine formation, that is preformativa, that is before formation of the dentine. Dental sac, that is your dental follicle. Before the formation of dental tissues, the dental sac shows a circular arrangement of fibers and resembles a capsular structure. With the development of the root, the fibers of the dental sac differentiate into periodontal fibers that becomes embedded into the developing cementum or alveolar bone, which is known as Sharpey's fibers. Moving on to the advanced Bell stage. This stage is characterized by commencement of mineralization and root formation. During the advanced Bell stage, the boundary between the inner enamel epithelium and the odontoblast outlines a future dentino-enamel junction, that is the DEJ. The formation of dentine occurs first as a layer along the future DEJ in the region of future cusps and proceeds pulpally and apically. After the first layer of dentine is formed, the ameloblast, which has already been differentiated from the inner enamel epithelium, lay down the enamel over the dentine in the future incisal and cuspal areas. So always remember, the enamel formation begins only after a first layer of dentine is formed. The enamel formation then proceeds coronally and cervically in all the regions from the DEJ, that is dental enamel junction, towards the surface. In addition, the cervical portion of the enamel organ gives rise to epithelial root sheath of Herdwick. The Herdwick's epithelial root sheath outlines a future root and is thus responsible for the shape, length, size and number of roots. Herdwick's epithelial root sheath. The development of roots begin after the enamel and dentine formation has reached the future cemento-enamel junction, that is a CJ. The enamel organ plays an important part in the root development by forming Herdwick's epithelial root sheath, which molds the shape of the roots and initiates radicular dentine formation. Herdwick's root sheath consists of the outer and inner enamel epithelium only. So you don't see stellate reticulum, you don't see stratum intermedium, you only see inner and outer enamel epithelium, and therefore it does not include the stratum and stratum intermedium and stellate reticulum. The cells of the inner layer remain short and normally do not produce enamel because we don't see enamel on the root surface. When these cells have induced the differentiation of radicular dental papilla cells into odontoblast and the first layer of dentine has been laid down, the epithelial root sheath loses its structural continuity and its close relation to the surface of the root. Its remnant persists as an epithelial network of strands or clumps near the external surface of the root. These epithelial remnants are found in the periodontal ligament of the erupted teeth and are called as the cell rests of Malassez. So what are the remnants of Herdwick's epithelial root sheath are called? Cell rests of Malassez. Where do we see? We see in the periodontal ligament of the erupted teeth. So in crown part, after a layer of dentine is formed, we see the formation of enamel. And in root part, after a layer of dentine is formed, we see loss of structural continuity of Herdwick's epithelial root sheath. Lastly, coming to the takeaway notes. Now the development of tooth includes histologically 4 different stages: bud stage, cap stage, early Bell stage and advanced Bell stage. In bud stage, we see 2 different types of cells: peripheral low columnar cells and central polygonal cells, and we see formation of dental papilla and dental sac. That is, the dental papilla and dental sac are still in forming stages. Cap stage includes 3 different layers: outer enamel epithelium, stellate reticulum and inner enamel epithelium. Outer enamel epithelium are low cuboidal in shape. Stellate reticulum are star-shaped cells which forms cellular network, and inner enamel epithelium are tall columnar cells. In cap stage, we see formation of four temporary structures, that is your enamel knot, enamel cord, enamel septa, and enamel navel. Coming to early bell stage, we see four different layers. That is, we see an addition, outer enamel epithelium, stellate reticulum, stratum intermedium, and inner enamel epithelium. Again, outer enamel epithelium is still low column cuboidal in shape, stellate reticulum is star shaped, stratum intermedium forms a layer of squamous cells, and inner enamel epithelium is columnar cells. And the events which we see in early bell stage is the stratum intermedium, which is rich in glycogen, helps in enamel formation. The collapse of stellate reticulum reduces the distance between the amaloblasts, that is, which are formed from the inner enamel epithelium, and the capillaries, which are formed on the surface of the cells of outer enamel epithelium. The outer enamel epithelium is laid down into folds, and between of which the mesenchyme of the dental sac condenses to form papillae rich in capillaries, which provide nutritional supply, and this is called as reversal in nutritional source. Coming to advanced bell stage, we see outer enamel epithelium, stellate reticulum, formation of future dental enamel junction, and stratum intermedium, inner enamel epithelium. The commencement of mineralization and root formation is seen in advanced bell stage. We see formation of future dental enamel junction, and the cervical portion of enamel organ gives rise to your Hedwig's epithelial root sheath, which forms a future root. Moving on to the mechanism of root formation. After the Hedwig's epithelial root sheath is formed from the cervical portion of enamel organ, which primarily consists of inner and outer enamel epithelium, it later forms epithelial diaphragm, which undergoes proliferation and proliferation to form roots. It can be single root or multiple roots, and the proliferation lags behind that of the pulpal connective tissue, where it forms the apical foramen. We see the proliferation of cells of connective tissue of the pulp, which differentiates into odontoblast and also forms the core of the pulp. Hope this session was helpful enough. Thank you. Signing off.